I think our program has a pretty robust didactic curriculum. We have education time scheduled into every day, and I'll maybe just run through what a typical week looks like for us. So usually Monday mornings is what we call a fracture conference, where we go over consults that came through the ER over the weekend or over the past week, and residents put up x-ray films and CT scans, and then in kind of a hierarchical pattern, we go through reading the imaging with the interns, and then we start talking about what the surgical options are, the treatment options are for the different injuries, and we use it as a way to review the cases and talk about the decision making involved. Tuesdays, we typically have residents or attendings giving lectures on different topics, and we kind of follow curriculum over the year and cover high yield orthopedic topics. And those are more like traditional PowerPoint lectures. Wednesdays are more of a subspecialty focused conference day. So the trauma service goes through like what happened in the OR, talk about different constructs, different operations that have been done for some of the patients on the trauma service. The joint service talks about different implant problems or complications or different points of learning in regards to joint reconstruction. Thursdays for the majority of the year is our anatomy curriculum, where the second year residents go through a full cadaver dissection, cover different topics, basically head to toe, and present their dissections to the rest of the residents, and go over the clinically relevant information as well as some of the nitty-gritty like anatomical landmarks, which I think is a really good review and is very translatable to the OR. And then on Friday is often our either interesting case conference or grand rounds. The interesting case conferences is a chance to do sort of a mock board scenario where residents will present a case to other residents and kind of go through the process of what's your differential diagnoses, what are you thinking about for this patient or for these image findings, and then also what treatment plans are available or what you would like to do. I think it's really good for forcing you to kind of grow in that autonomy of decision making and deciding on what would be best for the patient or what the options are, and it's a good chance to learn and get feedback from attendings on the way to approach different problems. And so I think throughout the week you have a lot of variety. It forces you to keep reading, it forces you to really study outside of just the day-to-day work.